Welcome to the Enluxtra Knowledge Base. This video is about Enluxtra technology, dressing application key points including sizing, peri-wound coverage, wound bed contact, packing material choices, and frequency of dressing changes, as well as the best co-products and simple ways to avoid common mistakes. Let's begin. Every wound care professional knows that wound healing process involves several equally important components: patient's proper nutrition and hydration, assessing underlying health conditions, wound offloading, and adequate wound treatment. Now, let's discuss wound treatment challenges. Today, the number one wound care challenge that medical professionals face is that wounds are complex, non-uniform systems, and treating an unstable system is very difficult. Various wound tissue types and areas with various levels of drainage coexist within the wound. Some parts are dry, some parts are exuding, there are areas of necrosis and slough. The normal healing process takes the wound from its appearance to complete healing through hemostasis, inflammation, proliferation, and remodeling stages. Chronic wounds, however, are frequently stalled in the inflammatory stage and require special care to resume the normal healing process. The fact is, the best way to jumpstart the healing process of a stalled or chronic wound is to treat each of the different components of the wound exactly how they need to be treated to achieve healing, all at the same time, localized over the corresponding area of the specific tissue type and component, following the evolving wound dynamically and reversibly. But how do we do this? It sounds impossible. Meet Enluxtra, designed with the power to individually address all the distinct areas in the wound. Enluxtra is the first and only self-regulating superabsorbent fiber dressing with adaptive absorbency and built-in adaptive hydration function. This means it is suitable for wounds with any drainage level, from lowest to highest. Now, let's take a look at this latest advancement in wound care technology so you can see exactly how it works. You can understand now that Enluxtra addresses every area of the wound separately, providing appropriate care for each specific location. It optimally absorbs exudate in draining areas of the wound without overdrying, optimally hydrates dry and non-exuding areas, supports natural autolytic debridement in areas with necrosis and slough. All this happens simultaneously, relevant to each specific area of the wound. But that is not all. The second wound care challenge is that wounds can behave unpredictably during dressing wear, making it difficult to monitor ongoing changes in the wound in real time. Now, Enluxtra is designed to respond to these changes. Its patented structural composition allows Enluxtra to automatically adapt the dressing material functions. As the healing process progresses, Enluxtra adapts to changing conditions of the wound. This means it optimally absorbs in areas that need it. It continues to support natural autolytic debridement where necessary, while creating optimal conditions for quick cell proliferation, granulation, and other healing processes, while it also maintains the delicate moisture balance at all times. In this way, Enluxtra is able to monitor the wound 24/7, dynamically changing its local functions in response to changes taking place in the wound and supporting wound healing process at all times. As the wound evolves, Enluxtra continues to adapt its local functions and treats every area of the wound separately, thus helping continue the normal healing process. To move past the inflammation stage, one has to consider bacterial burden, necrotic tissue, and moisture balance of the whole wound. Bacterial overgrowth or infection need to be eliminated, necrotic tissue in most cases needs to be debrided, and moisture balance needs to be maintained by moisturizing dry tissue and by drying wet tissue. When Enluxtra is applied to a wound, it treats all the different areas simultaneously, thereby ending the inflammatory stage and restarting the healing process. You may have already started to become aware of the fact that Enluxtra is able to heal the most difficult wounds. And for your success as a wound care specialist, it is very important for you to have Enluxtra in your arsenal. Enluxtra has been proven in practice and is recommended by leading national experts in wound care. It is adopted by leading hospitals and wound care centers internationally. So, how does it work? Now we know that Enluxtra can automatically change its function in any area of the dressing independently. This is possible because of the patented smart polymer structure in its composition. The core layers of the dressing are composed of proprietary synthetic polymers and inactive bioinert ingredients. Enluxtra's polymers are sensitive to changes in humidity and fluid content in each unique area of the wound. Polymers actively remove barriers to healing. Enluxtra is structurally designed to work in sync with the ever-changing wound microenvironment. In exuding areas, polymers sense high humidity and high moisture content and become more permeable to fluids. Enluxtra effectively absorbs any amount of exudate, exhibiting the highest absorption rate on the market. In dry areas, polymers sense low humidity and start optimally hydrating, maintaining continuous moisture balance and creating an optimal moist wound microenvironment. This is what Enluxtra looks like. Its material is soft, cushiony, pleasant to the touch, and very comfortable in wear. The surface that faces the wound is porous and non-adhering. Patients report soothing and cooling sensations the moment Enluxtra is applied. The other side is a breathable backing film, permeable to water vapors, but impermeable to fluids and microorganisms. It also serves as a strike-through barrier and protects from harmful bacteria. Enluxtra is safe. It is non-cytotoxic, well-suited for use in hyperbaric chambers, hypoallergenic, non-biological, and free from animal ingredients. It does not contain any active medications, is latex-free, and honey-free. Some of the key benefits of using Enluxtra include superior drainage management, continuous maintenance of optimal moist healing environment in all parts of the wound, including peri-wound skin, bioburden reduction by sequestering microorganisms, efficient support of natural autolytic debridement, evacuation of liquefied slough and microorganisms from the wound bed, MMP evacuation and binding, skin maceration prevention, desiccation prevention, pain and odor reduction, barrier for exogenous microorganisms and fluids, ensured uninterrupted homeostasis due to long wear time. Patients and doctors have also reported cases of reduced scar formation with continuous Enluxtra wear. Today, Enluxtra exhibits the highest absorption and retention rate when compared to any other product on the market. Enluxtra locks in exudate and prevents it from being released back onto the wound bed, even under pressure. Now, let's look at application guidelines. Enluxtra is very easy to apply and change, but to ensure maximum success, please note the following important points. As with any other product, you must first assess the wound using general best practice guidelines, such as measuring the size of the wound, including peri-wound skin, assessing the level of drainage, wound depth, presence of slough and/or infection, pain level and cause, and other components of the assessment process. Enluxtra does not require complicated care protocols. As with all advanced technology, following instructions will ensure the best outcomes. Following the basic rules we're about to show you will help you get the most out of your Enluxtra use, and your patients will definitely thank you. Rule 1. Choose a larger dressing size. Always use a dressing large enough to cover the compromised peri-wound skin and to overlap the healthy skin by at least 1 inch. If the dressing is too small, the skin and wound bed may become macerated, and healing will be delayed. Do not cut the dressing to wound size. Instead, trim if it needs to fit into a difficult area or interferes with body part movement. Rule 2. Ensure full contact with the wound bed. Enluxtra must be in full contact with the wound, with no tenting. If there is a gap between Enluxtra and the wound bed, the dressing material will not be able to absorb the exudate. This will cause slough formation and maceration of the wound and peri-wound area. If the wound has any depth, apply Enluxtra, press it down with your finger, place folded gauze pads on top, and apply a wrap. Press it down again to make sure there is no tenting, and Enluxtra will stay in full contact with the wound bed at all times. If you press down and feel empty space between the dressing and the wound, add additional gauze and compress or tape down to contour Enluxtra to the wound bed. For deep or tunneling wounds, pack the cavity with a wound filler and apply Enluxtra, making sure its undersurface is touching the filler, wound, and peri-wound area, as well as healthy surrounding skin. Do not use fillers that shrink or thick pastes that block vertical draw. This will cause wound maceration. Rule 3. Always change Enluxtra before the exudate reaches the dressing edge. Rule 4. Change more often initially. Enluxtra is designed to stay on a wound for up to 7 to 10 days. However, when you first start using the dressing, it is best to increase wear time gradually to clear the wound from any non-vital tissues such as slough and necrosis, since these semi-solid products of autolytic debridement may clog up the surface of the dressing. For heavily draining or very sloughy wounds, initially change Enluxtra every day until the drainage subsides. For all other wounds, change every 2 to 3 days. You may reduce the change frequency when the wound becomes about 80% free of slough. At this point, change frequency may be gradually reduced for up to 7 to 10 day wear time. So, key rules to remember. Choose a larger dressing. Enluxtra must cover the compromised peri-wound skin and overlap the healthy skin around the wound by at least 1 inch. Ensure full contact. Enluxtra must touch the wound bed or packing material at all times. Always change Enluxtra before the exudate reaches the dressing edge. When you start using Enluxtra, change more often initially. Every day for heavily draining or very sloughy wounds, and every 2 to 3 days for average wounds. When the wound is about 80% free of slough, the change frequency may be gradually reduced to once or twice per week. We will now share with you the best Enluxtra application practices from professionals in the field. Proper sizing is critical for best results. Larger dressing equals better outcomes. Think of Enluxtra as a container. The larger it is, the more exudate is absorbed away from the wound. The more exudate is absorbed, the more harmful bacteria and fluids are locked away from the wound. The more bacteria and fluids are evacuated, the faster the wound is cleared. The cleaner the wound, the fewer dressing changes you will need. Fewer dressing changes means longer time between changes. Medical professionals know that the less you disturb the wound, the faster and more efficiently it will heal due to uninterrupted homeostasis. When the wound is large or has an irregular shape, tape 2 or more dressings together to achieve full coverage of peri-wound areas and to overlap healthy skin by at least 1 inch. When covering a large area with several dressings taped together, cut off the sides to straighten the dressing edges and to ensure that there are no gaps where their corners meet. Trim Enluxtra only if its edges interfere with body part movement or around appliances that require a specific fit. Enluxtra is perfect for heel and toe wounds. Simply cut slits in the sides of the dressing and form a cup to cover a heel wound. Use a similar technique for toe wounds. When using Enluxtra for edema and under compression, first, using scissors, form a bevel of up to ½ inch wide around the entire dressing edge on the wound contact side and place the dressing on the wound. This will help prevent dressing edge from indenting into the surrounding tissue. Then, bolster cotton batting around the dressing perimeter and level out the transition from the dressing edge to the skin. This will further reduce and redistribute the compression bandage pressure on the dressing edge. Apply compression bandage. This bevel and bolster technique will protect the delicate skin from dressing edge indentation and give dressing room for swelling when it absorbs exudate. When applying Enluxtra alone, when you only have 2 hands to work with, use this simple technique to make the process fast and easy. First, prepare 2 small pieces of medical-grade adhesive tape. Then, temporarily secure opposite corners of the dressing to hold it in place and prevent it from sliding off. Now, apply a wrap. Securing Enluxtra for incontinence and showering is also very simple and fast. Use a moisture-resistant adhesive tape along dressing edges. Do not use paper or cotton-based tape. Alternatively, you may use a transparent film dressing such as Tegaderm, Opsite, or similar. The film must completely cover Enluxtra and extend beyond the edges for at least 1 inch. If the wound is dry, before applying Enluxtra, moisten it with saline or distilled water. No need to pat dry. Or you may apply amorphous hydrogel to the wound bed area or exposed tendon and bone. Then, completely cover Enluxtra with transparent film, making sure the film extends beyond the dressing edges for at least 1 inch. Although it is very rare, a few patients have reported irritation occurring while wearing Enluxtra. Do not automatically assume that this is an allergic reaction. Remember, Enluxtra is a hypoallergenic product. If irritation occurs, simply go through the following steps. Check if the dressing size is large enough. If the dressing is too small, drainage could begin seeping out of the dressing edges onto healthy peri-wound tissue. This can cause pain and discomfort, and the peri-wound tissue could begin showing signs of irritation, often mistaken for allergic reaction. Ask your patient at what time pain or discomfort occurred. Take the time of day and the day of wear into account. Reports about discomfort occurring around 2 to 6 a.m. might be due to ischemic pain. Reports around the 4th day of wear might be simply due to leakage from an overfilled dressing, and it might be time to change it. It is important to avoid products on our non-recommended list. These products may cause clogging of Enluxtra and impede the vertical draw of the material, preventing exudate from being absorbed into the dressing and spilling onto healthy skin. Note: patients' personal allergies to any product used in conjunction with Enluxtra could be amplified due to the moist environment created by the dressing. Please note that a true allergic reaction occurs within 3 hours after application. If a patient has an allergic reaction to dressing polymer materials, discontinue dressing use. However, anything after 3 hours past application is likely to be skin irritation caused by exudate and must be addressed as such. Frequently, placement of a non-adhering wound contact layer known to be tolerated by the patient under Enluxtra resolves the problem, and Enluxtra use can be continued. Changing Enluxtra is fast, easy, and painless. Remember to always change Enluxtra before the exudate reaches the dressing edge. Otherwise, exudate could start seeping onto healthy peri-wound skin. In case the patient is experiencing more discomfort than usual, you might need to adjust placement, size, or dressing change frequency. Please remember that regular Enluxtra wear is comfortable, and painless. As we know, Enluxtra is designed to stay on a wound for up to 7 to 10 days. However, when you first start using the dressing, it is best to increase wear time gradually to clear the wound from any non-vital tissues such as slough and necrosis. For copiously draining wounds, initially change Enluxtra every day until the drainage subsides. This usually takes about 1 to 2 weeks. For all other wounds, change every 2 to 3 days until the wound is about 80% cleared of slough. This usually takes about 1 to 2 weeks as well. To optimize Enluxtra placement for best results and longer wear, study the drainage patterns upon removal. Factors such as body positioning and gravity may cause the exudate to flow in one direction more than others. Place the dressing to accommodate for excess exudate flow. Now, let's look at recommended co-products that work exceptionally well with Enluxtra. If adhesive tape is needed, use Mebitac, Mefix, Hypafix, waterproof medical tape, or any other tape you prefer. Enluxtra works wonderfully under compression wraps, Uniboots, conforming gauze wrap, tuba grip, lymphedema wraps, and all compression pumps. When transparent films are required for dry wounds or incontinence and showering, use Tegaderm or Opsite. Packing materials we recommend are AMD gauze moistened with saline, antimicrobial PHMB impregnated, moist gauze with silver hydrogel base, or any hydrogel saline impregnated non-shrinking product. RTD foam strips by Keneric Healthcare, Yodaform strips, Hydrofera blue strips, Yodafoam. Recommended antimicrobials are Silvasorb, Silvercept, Anacept. Contact layers, Mebitel soft silicone, and Adaptic Touch without petroleum. It is important to note that some products are best avoided when using Enluxtra, such as all alginates, all cellulose products, all honey products, thick and viscous pastes and ointments, skin preps, all petrolatum-based products, moisture barriers. This completes our video. If you would like to contact us with any questions, please do not hesitate to do so. We are happy to help. Thank you for watching, and happy healing!